So on to the physical exam of the musculoskeletal system. You first want to inspect, then palpate, passive and active range of motion, and then determine muscle strength. So when you inspect, you want to inspect the skeleton and extremities for posture, alignment, contour and symmetry, size, and deformity. You want to inspect the skin and subcutaneous tissue over the muscles and joints for color, swelling, masses, presence of skin folds, and presence of deformities. You also want to inspect the muscles for the size, be it atrophy or hypertrophy, symmetry or spasms and fasciculations. You then go on to palpation. You want to check for heat, tenderness, swelling, crepitus, and muscle tone. Range of motion. You want to test the range of motion. In particular with the temporomandibular joint or the TMJ, there should be no tenderness on palpation. The jaw movement should be smooth and painless. You want to assess the vertical motion. Normal is space between the upper and lower incisors should be 3 to 6 centimeters or 3 fingers inserted sideways. You want to assess the lateral motion, and again, normal should be 1 to 2 centimeters. Lateral motion can be affected more frequently than vertical. You want to assess protrusion. Normal would be protrudes without deviation, and you want to assess the integrity of cranial nerve 5. For temporomandibular joint dysfunction, it's usually secondary to malocclusion, arthritis, dislocation, poorly fitting dentures, or myofascial dysfunction or trauma. You want to assess for neuroexcitability and the Schoffstick sign. That is where you tap the face just below the temple area and observe for ipsilateral changes in facial expression. Normal finding is no change. A positive Schoffstick sign is where the ipsilateral muscle spasm in the upward direction of the mouth and cheek, and it's associated with low levels of calcium and a tetanus infection. You also want to check the cervical spine. You want to check that there's no tenderness on palpation along the spinous process of the cervical spine. You want to assess flexion, which is normal at 45 degrees. Assess hyperextension, which is normal of 55 degrees. Lateral bending, normal of 40 degrees. And assess rotation, which is normal of 70 degrees. You want to assess the integrity of cranial nerve 11 and the strength of the sternocleidoid mastoid and the trapezius muscles. Torticollis is a rotation of the head due to spasm of the cervical musculature, and the head tends to be held to one side or turns involuntarily. This is more common in children. Klippel-Feil syndrome is a congenital absence of one or more cervical vertebrae, along with fusion of the upper cervical vertebrae and bilateral elevation of the scapula. This tends to result in a shortened neck appearance and may be associated with low hairline, webbing of the neck, and decreased neck mobility. Nerve root compression or radiculopathy leads to numbness, tingling in one or more of both the upper extremities. Clinical evaluation of the cervical nerves will help localize the disc lesion. Example, C5 to C6 disc herniation will cause a C6 nerve irritation and numbness and tingling along the C6 nerve distribution, which would be like the thumb and index finger. Osteoarthritis, that would be diagnosed based on history, physical exam, and x-ray. And then cervical strain is due to muscles and tendons being involved, post-trauma or overuse of muscles. No neurological findings. You would see diffuse tenderness common. Muscle spasm may be palpable. Pain tends to increase with lateral flexion. No limitation in the range of motion. And Sperling's maneuver does not increase pain. Sperling's maneuver is where the head is laterally flexed toward the side of complaint, and you see progressive downward pressure to the neck and head. Reproduction of symptoms or collapse would be a positive finding.